Hi, my name is Kelly. I am a therapist. I work on an emergency crisis response team for community mental health, and we work with people in their most heightened emotional states. We work in the jails, we work in the school system, we work in the community, we work with a lot of low income people. We have a center where people can come in and we go into people's homes. So I mean, anywhere where there could be a person, that's where we go.
I appreciate you making the time to talk to me today about some of your experiences and some ideas you have to help others right now, and some ideas on how we should treat this as a warning to change our behavior moving forward from this. How was the transition from normal life to going into social distancing, lockdown, stay-at-home orders, and all that?
The transition was pretty drastic because I had just come back from a friend's wedding in Hawaii, so I was around lots and lots of friends.
It might have been nice to get quarantined in Hawaii with some friends and stuff on a tropical island. Like, oh no.
Within work, it's been really just day by day. We literally had our head health guy come in and say, like, you're all probably going to get COVID. It's just a matter of how you respond to it and the safety that you have around it when you get it, and not to give it to other people, and be really responsible. And we may all have it already and not have symptoms. Like, no one really knows.
It's terrifying.
It's pretty scary.
The head person being like, you're going to get this deadly infectious disease. We talked a little bit about it earlier, but that's kind of like the definition of altruism, is helping others at the detriment to yourself. The community thanks you for all your hard work right now.
I just feel so grateful that I do have, the privilege, and that I am healthy, that who knows if like I get COVID, what it's going to look like for me. But I just feel like, I do have resources to be able to go to the hospital, and I have insurance, and, all those things that a lot of people don't have.
Are you able to share any of those types of experiences in shelters or in jails or on campuses or anything like that with us?
Yeah, I mean, I've definitely seen and worked with a lot more clients who have, seems like, more severe cases of suicide attempts, and in college students especially. I think that being away from home during this time is probably hard for them, and then also having all their social circles taken away has been hard for them as well, just in the clients that I've experienced. And just the not knowing, like, they just graduated, and are they ever going to get a job, and just all this just the not knowing, the fear of the unknown. And then within people in the shelters, I know that there's a lot of fear of still being in close quarters with people who have chronic illnesses. There's a lot of homeless people that I've seen who are really afraid of getting COVID and giving it to their elderly parents, or just not being able to have the resources to survive if they do get it. We've met with some people who could potentially have it, and there's protocols and processes around that as well. But there's a lot of mental health that happens when you find out you have this virus that people really don't know much about.
This hasn't really been talked about much in the media. Most of it has been either death tolls, safety protocols, or what's happening with the economy. But we haven't really addressed or talked about the collective mental health toll this is taking on all of us, because this is unprecedented. Nobody could imagine to prepare for this or how to prepare for it. So we're all kind of just figuring it out as we go. So I'm sure a lot of this has been really stressful for you and your patients. Has there been any good outcomes?
We've had less clients, which is allowing for me to spend more time with clients. We're just kind of like first responders that respond to wherever the crisis is happening. And so I've had this beautiful experience of being able to, versus seeing, in my day, like, multiple people and having to help manage a crisis and then, do all these other things. I've been able to really just be with people while they're in crisis. Everyone's crisis is going to look different, and being able to have the time, the resources, the patience, the understanding to really be there with someone, I'm feeling like the results are a lot better.
That's great, Kelly. This is I
I'm
know
getting
how.
too from the clients that are just like, like that session at 2 a.m. in the dorm room, like saved my life. And I'm also like not as stressed going into work because I know that there's not going to be as much expectation to like go, see more people, like bill more for insurance. Like it's more of just like going in and like whatever's going to happen today is going to happen. And
Mhm.
just having that spaciousness and openness to be able to be with people has been just incredible.
Yeah, that's amazing. I'm sure, yeah, having you be less stressed is helping other people for sure. And not to dismiss all the other stress that is accumulating because of this, but I keep seeing a few silver linings here and there. And I think the main one is that things have slowed down and people are able to kind of take a deep breath and commit more to the important things.
Like the teenagers that we're seeing are, they're stressed out and they're coming in because they're, maybe they have more time around their family, but they're not stressed out because they have all these high expectations of them in school and in sports and,
Mhm.
all those extra stressors that we see. It's just completely different. The cases are really just different in the stressors of the people that we're seeing.
Yeah, this must be a huge curveball for you. Like they didn't cover global pandemic in your education, did they? In terms of working with the homeless population, is there anything, any ideas that you have that can help that population?
There's the COVID shelter in Boulder. It's all volunteer run. There's still all these resources that are out there. And if people have extra time, it's always great to donate your time. You could, sit 6 feet away from a homeless person and have a conversation, really get to know them. Like there's oftentimes where I am on the scene of a crisis and it's dealing with homeless people. And like, I don't even know how to respond or react to it, but just really trying to see where that person's coming from and try to understand what's going on for them inside their head, inside their body, inside their spirit, like that can really really help someone,
Yeah,
whether
for
it be a
sure.
homeless person or just anyone. Like smile at a neighbor, smile at someone from across the street. Just those little pleasantries, I think, are really, what I used to experience in the world before everyone was on their phone like zombies. It was like the
Yeah,
zombie people used to talk about the zombie apocalypse, and I'm like, it's already
it's
happening. People
here.
are walking around like little
Yeah,
zombies. Like it's already going on.
yeah,
And so, yeah, I think that, any sort of money you have to donate to like, community mental health shelters, like whatever the cause is, like humane society, whatever the thing is you believe in, whether you have extra money right now or time, like money is time. So, whatever it
yeah.
is, find something that's important to you and figure out a way that how you can give back.
Thank you for that information because I always feel like there's a lack of empathy towards people that are homeless. What turned around my mindset about the homeless population was living in an area of Denver where there was a high homeless population. And I also read this article about homeless people with pets and with dogs. Just that article reframed my idea about homeless people in general, about how, like, oh, I guess I did have these underlying biases about them. And like in that article, they talked about how, like, um, those pets are actually super well taken care of because like they are with their buddy, their owner 24/7. They have like somebody that's there to love them constantly, and that emotional bond is so strong because they're like, we're in this together, man. This
Yeah.
guy's my homie, like ride or die right here. There's plenty of other places to get like pet food and stuff like that. So after that, I read that article too. I started to make a note of like to like check out dogs to see if they're like well groomed or undernourished. And I've never seen a homeless pet that was looking like it needed like medical attention. So since we talked about how this is kind of an unprecedented crisis that is causing a mental health crisis in itself, um, how would you advocate for people to seek professional help?
There's tons of options out there. The Colorado Crisis Line, I always like to give that to people because that's just a huge resource. You can call them, you can text them, whether you're having a crisis or someone who's having a crisis, you can call them for information. So you can just call and say, hey, my roommate's, seeming like she's suicidal right now or depressed or whatever. Like, can you help me with helping people with depression, or what can I say to her? And they'll really walk you through a lot of these different scenarios that may be new to people, and they may not know how to react in a situation like that. So that's if you're in Colorado, that's a great. And even if you're not in Colorado, you can call.
You had mentioned earlier how right now it's harder to run from yourself because we have less distractions. So we're like more in tune with ourselves and our emotions. So this might be kind of a pivotal time for people to to ask for help if they need it, because they might be having new stressors placed upon them, like unemployment, or if you're have anxiety about catching the virus, or if you already have, whatever the case is.
Yeah, it's like the stressors in our life have shifted now. So it's just noting
Mhm.
what those are and then noting what, for each individual, what they do to help work through those stressors in their life. So like someone always told me that self-care is what you need in the moment. So it's giving yourself what you need in that moment. It could look like having a beer with a friend. It could look like doing some yoga. It could look like eating ice cream. Like it's just whatever you're feeling like you need in that moment. And I think that that will help with stress as well.
For sure. Yeah. You do you, girl. So I think it's important to note privileges in being able to seek and work on your mental health. I know that in some cultures, it's not a big thing that people are aware of, or people don't have access to seek help.
I had an experience when I was in Nepal traveling, when I was out, and I was asking a lot of people there about mental health and what their views were on mental health and anxiety, depression. And I remember this guy just looked at me and was like, "We don't have time for mental
Yeah.
health. We don't have time to be depressed. Like we are just surviving every day. Like
Hmm.
we're peeling the beans and making the dal bhat and doing the laundry at the, it takes hours and hours and hours to do your laundry there. And then just to hang it by a dirt road where it gets dirty again by the cars driving by." And I remember thinking like, wow, what a privilege it is to have time to think about your issues and then to create anxiety and these different things. And
Yeah.
then with that, like what a privilege like it is for someone like me to be able to go to school and, have this debt and money to be able to give back. And so I just think that like for me, like privilege is when like you think something isn't a problem because it's not a problem to you personally. And it may
Hmm.
be because you don't even have never even had to think about something. That's a privilege.
Exactly.
That's hard
Yeah.
to, yeah,
Yeah, that's hard to conceptualize for people
conceptualize.
because they
Yeah.
haven't experienced it. So then they're like, "How's that a privilege?" Because that's not a thing for me. And it's like, exactly, that's why it's a
Yeah.
privilege. I haven't thought about how I've always had a washer and dryer. Yeah, I think people get triggered sometimes by that word privilege because they think it takes away from the hard work that they've done to get where they're at. But it's not taking away. It's just recognizing that person or we haven't had certain obstacles that other people have had to overcome. You don't need to feel guilty about being privileged, but you need to use your privilege to help others, basically. So, for example, you've had the opportunity to go to school for 8 years, and you are using that education to help others in mental health crisis.
Yeah, and I think it's really important too because there's so many people that have the opportunity to, have self growth and do have spiritual experiences and whatever it is, and that like it's nice to go through those experiences, but then the next step is like, now how do I implement this and how do I give this back to my community and how do I take
Mhm.
these things that I've learned and help others with them? It's really good to talk about privilege, and I think that oftentimes people with privilege, like I noticed when I first started talking about that conversation, I felt really like afraid to say anything because I was afraid that I was going to say the wrong thing. And I think saying the
Yeah,
wrong thing and having someone point it out is for me just show a big lesson in humility
yeah,
and
and growth.
really
Yeah.
help point out the privilege that I have that I don't, that like now
Mhm.
I do have to think about what I'm saying. Like now I do have to think about things, but then I'm still gonna say them and I'm still gonna think about them and I'm still gonna mess up and it's a learning process. And the only way to get better at it is to just jump in and fumble and have someone point things out to you or,
That's a really good point, and that takes some bravery too, because like, yeah, I could be totally. There's times that I'll like refrain from saying something because I'll be like, oh, that might come out wrong, and I'm not sure if I should say this or not. And then you don't want to get lambasted or embarrassed, but at the same time, if I don't say anything and I don't get corrected, then I might sit in that certain mindset for the rest of my life. What have you been learning from some of your experiences that you want to take on to the post COVID-19 era?
to really reconnect with what's important, community, friends. We're in such a culture of doing that it's always when I do connect with people, it's like, what have you been doing lately? Like, have you been skiing? Have you been mountain biking? Like about the doing and the actions and the things they've been like physically doing, versus like the being of like, how are you? Like, how's your soul? Like, what's happening for you in your life? Like, what's actually like,
Yeah.
what's real?
Yeah, that's one thing about reconnecting with people right now of having like Skypes or phone calls with them because you can't be like, what have you been up to? It's like
Yeah.
in my house. And then also when when we meet up with people, it's often focused on an activity, whether it's
Mhm.
at a bar with drinking or like a party drinking games, or it's funny that those are my examples of like
Game
activity,
nights.
drinking. No,
Game nights.
or like going to movie theaters or out to eat. It's often focused on the activity rather than each other.
Yeah,
So yeah, I think that'd be important. Focus more on each other than what activity that you're going to do. Like we don't need to go
exactly.
do something crazy or spend a bunch of money on something. You just go hang out and be in each other's presence.
I have been implementing spending 30 intentional minutes per day with my dog. Oh, is my baby. Like connecting with what's important for me, it's my dog.
Hmm.
And having just right now in my schedule, since it's a little less hectic, implementing those things into my schedule now so that when things do get more hectic, I already have that as a habit that I've been working on putting in my schedule.
Awesome. So you're creating a routine that's more set up for your mental and physical health.
And making it something that's like something that I get to do, something that brings me joy versus something that I have to do.
Yeah. Yeah,
Yeah.
that's an important mindset to I have the privilege of doing these things, of having a sweet dog that I get to spend time with. I also like how you had mentioned that mindset shift of like doing things intentionally rather than obligatory. Do you have anything else to add about lessons that we can carry into that we're learning now to carry into the new age? I keep saying it like that, like
The new age.
yeah, the new world,
The
brave
new
new
world
world.
where aliens roam the planet.
I
um
hope some aliens. I saw that they finally released some footage of UFOs, the
yeah, I saw
Pentagon one.
that.
They've
All the
admitted they're
pollution's going away, the aliens, you can see them.
yeah, and it barely like registered on the news because everything's so crazy. Bring on the aliens for me. I'm ready for it.
Okay, wait, back to yeah, okay, I got it. Okay, I'm here. Okay, so I'm a wilderness therapy, so I do wilderness work and
Hmm.
therapy work. And one thing that we do with children, like little kids, little teeny 5-year-olds, is we do this thing called counsel. 3 rules for counsel are: listen from your heart, speak from your heart, and get to the heart of the matter. And those are the 3 things that I've really been trying to do in my relationships now, since things have slowed down and been a little simpler, is I'm really trying to like listen from my heart. Like, what is this person really trying to say? Who are they? What are they showing me right now? What are they, like asking more questions to get to the heart of the matter. And then when I'm speaking, really to just connect to that, like, okay, kind of like closing my eyes and just letting stuff come out versus like rehearsing a conversation. And I think that that's been a beautiful thing that has really been great in being intentional in connections with people, in the clients that I'm seeing or my friends or whatever. Just those 3 little things.
That's essentially the 3 things that I've been asking people as kind of like a bare bones outline to these interviews is what are you learning? How can you help? And what should we do moving forward from here? And I think those 3 things kind of line up with what you're saying of
Yeah,
listening to yourself, listening to other people, and then finding the bigger picture together type of thing. That's
totally.
well, maybe I'm just making connections that aren't really there, but I think that's a connection. Those are 3 really good principles that can be applied on any scale, whether it's one person or as a society doing that.
Imagine if our politicians did this.
Imagine that's a whole nother. Let's make a whole nother video on that.
Yeah. Bring back the pandemic and talk
trying to
about
trying to
that.
stay positive, Kelly. I really appreciate you taking the time to share your insight as a mental health professional, and sharing some of your experiences with the places that you're working and the lessons that you've been learning about kind of slowing down and reconnecting with people.
Thanks for taking your time to do it too. And I do think that it's important to know that those services are still going on. Crisis services are still there. Colorado Crisis Line is available 24/7. We're there 24/7. So if anyone needs help, like, there's people to reach out to.
Absolutely, yeah. People are experiencing some different types of stress right now, and I think it takes more courage to ask for help than to sit in it and try to figure it out yourself. I think that will be all, and I'm going to
Go
add
talk
that.
to your dog if you have the time to.
Yeah, go
Well,
walk your dog, teach it some
be
tricks, visit freelance dog training on YouTube to learn some tricks.
be the person your dog thinks you are.